Laparoscopic surgery is a form of minimally invasive surgery. Rather than the old-fashioned type of surgery where we would make a large cut on the abdominal cavity and the surgeon and his assistant would place their hands inside the abdomen, in laparoscopic surgery we're using a number of smaller incisions into which ports are placed, and then instruments or a camera can be placed through those ports to enable the operation. The surgeon's looking at a TV screen, usually above the patient, and instruments are being utilised above the patient's abdomen so that the surgeon can then go ahead with the operation. We can introduce things that can cut tissue, that can stop bleeding, that can join tissue together, and that enables us to do a whole host of different operations, from rather minor surgery to more advanced techniques. We utilise this type of minimally invasive technique dependent on patient factors and also dependent on the operation we're doing. If patients have had previous abdominal surgery, sometimes it can be difficult to use a laparoscopic technique. We'd often use it for more minor operations, things like removal of a gallbladder, for hernia repairs both in the groin or in the abdominal wall, but we can also increasingly use it for more complex operations, and that would be potentially removal of part of the pancreas gland, the spleen, or even for sometimes things like liver resection, where we're removing a tumour from the part of the liver. This type of surgery will be performed under a general anaesthetic. It would normally involve making a small cut somewhere around the belly button of about 1 centimetre, through which a port and then a camera can be placed and gas can be introduced into the abdominal cavity. We then place a number of smaller incisions in different areas of the abdomen depending on what operation we're performing. So for example, if we're doing a removal of a gallbladder, a so-called laparoscopic cholecystectomy, we would make a small cut by the belly button and then 3 smaller cuts in the top of the tummy, 1 in the midline and 2 on the right side. We then introduce instruments into those ports and we're able to disconnect the gallbladder from the liver and the surrounding bile ducts, and then place the gallbladder in a bag so that it can be removed from the umbilical port. We then make sure that there is no bleeding in the abdomen and no collections of abnormal fluid, and we could then release the gas from the tummy, remove the ports and close the abdominal wounds. The patients would often go home the day of surgery or the day after surgery with very little pain after the operation. The major benefits are to the patient in terms of the way they recover from an operation. If you think about old-fashioned incisions where a large cut would often be placed on the abdominal wall so that the surgeon could put their hand inside the abdomen, the cut was going through muscle. That would create a lot of pain for the patient and it would delay their discharge from hospital for several days. It would also mean that the patient would require very strong painkillers, which were often morphine-based and came with side effects. Those wounds had a high chance to become infected or to even form hernias in the future. So the benefit of laparoscopic surgery is that the incisions are very small. That creates very little pain for the patient when they wake up from the surgery, and also means the requirement for strong painkillers is much less. The patient can be up and mobilizing very quickly after the operation and sometimes can be discharged the same day, clearly depending on their recovery and the type of operation they're having. It also does make advantages for the surgeon in certain operations. For example, in a larger patient where we're trying to do a gallbladder operation through a small open incision, it can actually be quite difficult to visualize the important structures, whereas the view that we attain with laparoscopic surgery enhances the ability to do the operation safely.